Thank you, everyone, for joining today. I'm Scott Taylor. I'm the CEO and co-founder of Perks Health. And I think today's topic is one that I think probably nearly everyone in healthcare can relate to, which is the, at times, disconnect between vendors and health plans. I think whether you're building solutions, whether you're buying solutions, or you're stuck in the pilot graveyard, I think we all know that these partnerships can sometimes be tricky to get right. They can sometimes take a fair bit of time to get off the ground. And I think importantly, we with all the work that goes into making a vendor health plan partnership, get a vendor health plan partnership in place, it's really important to get them right. I know at the end of the day, I think most health plans are flooded with vendors. A lot of them sound the same, and it's often hard to know who to move forward with, or who to engage with, or who to pilot with, or scale up with. And I think that's why this topic really matters, because I think at the same on the other side, vendors often feel that they're somewhat shouting into the void. And in the reality that they're not wrong. There's 300,000 digital health solutions out there, only probably a couple of hundred of health plan executives evaluating them. And I think somewhere in the middle, there's a lot of kind of wasted potential, probably frustrated executive inboxes and a lot of misconnections. And that's why I'm super excited to have Dallas Elmore here as our guest today. Because Dallas has sat on both sides of the table, and that's often pretty rare. I think, he's spent time leading sales and partnerships on the vendor side, and he's now Chief of Staff for Growth at Providence Health Plan. So he's seen what works and more importantly, what doesn't work when it comes to vendors engaging with health plans. And he's very kindly to share, volunteered to share his perspective on how health plan executives can pick the right vendor. And I think importantly, how vendors can do a better job at working with health plans. So thanks so much, Dallas, for joining us today.
Yeah, of course, Scott. First off, thank you so much for the invitation to be part of this conversation. It's a topic I find really interesting after sitting on really both sides of the table. I want to make sure I throw it out there that I might not have all the answers, but I think my perspective is an interesting way to lead this conversation. I've got a background that I would call a bit diverse in my sales outreach. Starting my career actually as a copier salesman, going around to business parks, dropping off cards, having that couple of seconds of live interaction to try and engage and maybe find an opportunity, maybe close a deal. There were times maybe office security might try to encourage these sales folks to leave the buildings. We probably all
They're
seen that.
real gatekeepers there, like physical gatekeepers.
Exactly.
Yeah.
And so, but that taught me about how to take no's, thick skin, and your sales outreach. And so, I think that kind of built the foundation as part of my personal sales career that then transitioned into healthcare, selling enterprise solutions to C-suite executives and doing a lot of things I thought were right, but I've often I've found through some of this experience that maybe there were some pitfalls. But maybe if I can just even back up a second, just kind of introduce myself. So again, Dallas Elmore. Chief staff at Providence Health Plan. The pleasure of serving as part of our commercial leadership team, and also have responsibilities, or commercial sales leadership team, sorry, and I have some responsibilities managing the execution and strategy behind our national route network strategy approach in the marketplace. And so a diverse set of responsibilities. I think in today's world of healthcare, that I think we're all doing as much as we can to try and accomplish as many tasks and challenges. And so I think it gives me an interesting perspective based off a lot of the vendor outreach that comes my way.
Definitely, definitely. And so the way that I'd love to spend the kind of next 30 minutes or so is that we'll first dig into your experience trying to break into health plans as a vendor. Then I think we flip to the other side of the table and talk about what you've learned from being within the health plan and having to evaluate these vendors. And then I think one kind of way to wrap that up is also to talk about like how you've seen that done really well and kind of bringing both sides together. And then at the very end, we'll do some Q&A. So I know Hadley, who's moderating, has posted in the chat that there is a Q&A function. So if you have any questions throughout the course of the discussion, please throw the questions in there, and we'll try to get to a few of those questions at the end of the session. But I think leading out with the vendor viewpoint, let's rewind back to when you're on the vendor side and selling into health plans. Like, what kind of work were you doing, and how did you approach selling to plans?
Yeah, when I reflect back on that part of my career, from an outreach perspective, a lot of this would come from either driving it towards our own team, from leadership, whoever it might be. We always thought it was a volume game, right? It was the more outreach that we put out, the more successful we'll be. Let's tell everyone how amazing our solutions are, how they're going to solve their problems, and then ask them for time. if it's in person, on a call, whatever it might be. I did a lot of that. There were days I would send out 300 mail merge emails thinking, yes, like, boy, look at me. I, just sent a bunch of bullet points saying, why we're better than an incumbent vendor or why we'll solve some general problem that, we all decided was going to be our focus that day. Um, you know, through those efforts, I thought we were doing the right things, right? I mean, we're selling big enterprise solutions. We're trying to solve problems from a vendor perspective. I mean, typically your intent is pure, right? You do feel that your solution is going to go out and solve an issue. It doesn't always land though necessarily with where those executives or those people you're trying to reach out to, like what they're actually trying to solve at that time. And so um, in those days, a lot of outreach, a lot of variety of phone calls, email, LinkedIn, heavy LinkedIn user. It didn't always land.
Yeah. And what are some examples, like specific examples of like really bad outreach that you've seen, either that you've done yourself or maybe perhaps you've actually seen on the other side, or you can be anonymous and yeah, not identify whether it's yourself or someone else.
Well, like I said, I was reflecting back when I was on that side of the table, and a lot of the what I would call rough or I don't want bad's a tough word to say, but some of the ineffective outreach that I see today, I've absolutely done the same stuff at some point in my sales career. And so I think that was eye-opening when being on this side of the table. LinkedIn is one of those where you accept a LinkedIn invitation, then 5 seconds later you get a sales pitch, right? And that sales pitch is very generic. Clearly, there's not a lot of thought behind like what is a core issue that Providence Health Plan is trying to solve, or any health system or health plan. And so those ones, I think if you were to come back, and I guess I could use an example of a positive LinkedIn interaction. I had a salesperson reach out to me and call out a post that I had done in the past about that there's no stupid questions, something along those lines. So she framed it as like, hey, like I was looking at some of the content you put out on LinkedIn, and in the spirit of no stupid questions, here's my question to you about a particular problem that Providence Health Plan may be trying to solve, and here's how our solution might be able to solve that problem. Ultimately, there wasn't a fit for us, but yeah, I reached out to that salesperson. I was like, I let her know like, wow, that's great outreach, thank
Yeah.
you, and like that's a person we want to stay connected with. On the flip side, we talk about poor outreach again. Like I mentioned, the mail merges was something that I did a lot of as a salesperson. And again, you feel this sense of accomplishment that you sent out 300 emails. Um, but if I had $1 for every email that came through that said, "Hi, Dallas," and then listed off,
Yeah. Yeah.
all the different things that this vendor does, and I'd have a lot of dollars. And
Yeah.
as
Yeah.
soon as you see that first, maybe Dallas is in a different font, or it just clearly wasn't well thought out, that just goes into the trash. And so it's very ineffective. I think what's important, if you're a vendor on this call and you're trying to get through to, health plan executives, health system executives, whoever it might be, you really need to hit something in those first couple of sentences, right? Like either show that you've done your research about a problem that we're looking to solve. Um, Show us in the first couple of sentences what it might be, because I get a lot of outreach, but think about our CEO or other people in our C-suite, right? I mean, it's just going to keep growing in those scenarios. And if there is if there's a value statement to start that message that makes sense, and maybe I'm not the wrong person, I'll pass you to the appropriate person if there's something I see that checks a box of something we're looking to accomplish or problem we're trying to solve.
For sure, for sure. And I think that, that kind of very final point of what you just said, or like a problem you're trying to solve, or that is like a current pain point is, making sure that there's like that clear alignment in priorities and understanding what those priorities might be and doing the little bit of research before the call to kind of whether it's like, both at the individual level of what they care about or at an organization level, what they care about right now can be so critical. I guess looking back, from now being inside a plan, what was an idea or a concept that you were completely wrong about as a vendor in kind of either the buying or the evaluation process, as like a health plan looking at a vendor?
Well, as a vendor, yeah, I think I'll continue down the outreach path just for a second longer. I think it's about working smarter versus working harder, right? I mean, smarter being, and I guess you could look at that either way. I mean, maybe it's harder to go do the research and appropriately like have a concept or a message. So maybe in theory that's harder, but I think the payoff's bigger of ensuring that you're just delivering, meaningful, powerful messaging, right? that's going to get you through at least either to myself or to the appropriate person to even be part of that process. I think being on this side of the table now, there's validation that it is very difficult to get a solution across the finish line. And so yeah, I think that's eye-opening, right? As on the vendor side, you sit and say, I'm trying to get a pilot across the finish line or whatever it might be. Um, Here's the reason why our solution is so good. I don't understand why they don't want to move forward with this particular solution, where it might be the perfect solution for us, but the timing might be wrong. Um, there might be competing priorities. Um, it just might simply require too many approvals and just too much to get across the table, or budgets are truly a real thing. And so I think, from my perspective, the reality of the challenges that from a vendor perspective, oftentimes you'll hear like, oh, we're trying to get a contract through, but it's going to take all this time. A lot of sales leadership wants to push those salespeople to say, make sure, get this done, or price is going to go away, or whatever it might be. And there's a reality on both sides of the challenges to get things done.
Yeah, I think there's like a lot of, and I'm guilty of this myself with our sales team, who may be on the webinar, but like, yeah, how do we create urgency here? And
Of
like in
course.
some cases, the answer is like, there is no way to create urgency. This is just a process that takes time. And the urgency will be driven by the health plan priorities, not by some sort of like time expiring discount that may work with a kind of a regular SaaS product. But yeah, in the buying cycles of
Yeah.
health plans, it's very different.
If I could just build on that, Scott, I mean, that's a great point. Yeah. When I've been on the vendor side, even if it was a reality for us that, hey, like, listen, we need to get this done before the end of the quarter, or we can no longer offer this price, even if it was a reality, if you're on the other side of the table, if you're a health plan executive, a health system executive, and you're fighting all of these competing priorities, review, we have steps to review solutions that come through, multiple teams. It's just not one person who can say, yes, we want to do this, right? And so sometimes, even if that pricing goes away, there's just a reality that it can't move forward. And so I think finding that balance of, yes, as a seller, of course you want to go close your business, right? And it could be, and I because I've been on that side of the table, I know that's a real thing oftentimes. But just to have it be clear that it's also an extremely real thing. Where yeah, sometimes the process is just more powerful. We can't control it more than as much as we'd like to, right?
For sure, for sure. And I guess maybe kind of leading on from that, I mean, what is the thing that really surprised you, like when you kind of stepped into the health plan executive viewpoint that, you had either underappreciated or maybe not even realized was the case within that kind of decision making process or that evaluation process of a digital health vendor?
Yeah, I think it just building on what I just had mentioned of just the required steps to get
Yeah.
something done.
It's how many people, how
Um,
many stakeholders were actually behind the scenes versus the champion who you were checking in with every week or two.
yeah, I mean, at Providence Health Plan, we've done a nice job of trying to tighten that process, trying to, not let individuals go make decisions and own contracts. And so, we're trying to tighten it so that there's a flow and a process that we follow, which I think has been very effective for us to help manage those vendor partnership relationships, ensure that there's not vendor overlap, because I mean, that's a real thing, right? I mean, ensuring that like if you've got a partner that you're leveraging all the solutions that partner can do to help solve those business problems. I think a trap that we've gotten into in the past of maybe we go forward with a vendor that does one particular thing, we have another vendor that maybe can do the same thing, or maybe there's some consolidation opportunity. And I know from being on the vendor side, you never want to hear that, right? You always want to be
Yeah,
on the
sure.
positive side of that consolidation. But
Yeah.
it goes in ensuring that you're creating value and making the lives easier of those people you're working with at the plan or the health system, and fulfilling your promises. And so, um, yeah, I mean, I think there's definitely some reality of the challenges out there.
Yeah, definitely. I mean, that point solution fatigue is real. Like when you've got a small team that is managing a lot of these vendor contracts, it can be really tricky if are having one vendor to do one thing and then there's another that can do five things, including that one thing. I mean, it becomes a bit of an easier decision than having to go find four other vendors to fill out the rest.
Yeah,
What other traps in, maybe going beyond just like the buying process, but also like the evaluation process, well, buying and evaluation process, um, do you see health plans kind of falling into like, and I guess having sat on the other side and you're probably, selling those solutions and thinking about like what you're selling, like what are some traps that health plans sometimes fall into in, not evaluating buyers effectively enough or vendors effectively enough.
Yeah, for us, a very important component of any solution that we look to bring on board is an ROI, right? I mean, I think it's important to know that there is a strong, validated return on your investment on a solution that you bring in. Um, and that's almost a foundational first step of if we're evaluating something, right? From a vendor perspective, and I guess even from a buyer's perspective, I mean, I've been on the table, on the vendor side where you'll throw out a general ROI, like, oh, we can save you X amount per year or through this contract term. And that's something that's very important. I think it's so important for the vendor to truly lean in and validate that. We've gone through some interesting vendor evaluations in the last year and a half or so, where we brought in multiple stakeholders from throughout, finance, compliance, IT, sales, all these different groups within Providence Health Plan to ensure that we can bring the right information in to validate those ROIs. I mean, if it's a real solution, if it's a vendor you're in a partnership that you're really truly evaluating, I think partnership then becomes the word. Like, let's work together, ensure that we truly demonstrate what the value is, the return is, the business problem that we're looking to solve together, how we'll get there together. Yeah, I think pitfall on both sides can be just assumptions, moving too quick, and again, all things that I think a lot of vendors won't want to hear. I never want to hear it from a vendor's perspective of like, oh, we got to go through all these steps to get this done. Um, but I think validation and ensuring that the promises made could be fulfilled, I think is huge. And again, Providence Health Plan, we've done a nice job of trying to put together a process, as I'm sure other plans and systems across the country do, just to ensure that we do have that checks and balances, so that you don't fall in love with the solution while maybe there is another tool out there that can do the same thing. Maybe there's some gaps that we're not looking that maybe go against whatever the ROI or the sales pitch is. And so I think just checks and balances, reducing assumptions, validating everything that you're doing before you move forward. I think is all, of course, very standard, but also very important.
Yeah, absolutely. And I think like on ROI in particular, it's like finding that middle ground on like, not just accepting whatever number was on their perfectly manicured slide that was obviously probably like cherry picked from the best program or best population, and then really kind of digging into the assumptions. Like, what are we assuming in terms of like uptake and utilization? What do we assume, like, what type of population, like, does that population look like our population?
100%.
How engaged did people have to be with a solution to actually see results? And but at the same time, I guess there's also like you can go too far down the rabbit hole where the only answer is like, have they delivered outcomes with our exact population? And the only way to kind of really determine that is by running a pilot or running an initial contract. And so kind of finding that middle ground of like getting enough confidence that there is return on investment there, without kind of almost doing a theoretical pilot in your head, can be kind of the big trap.
Yeah, and
Um,
that's a
so,
great call. Scott, if I can just jump in on that real quick. From the vendor perspective, yeah, there were so many times I was like, hey, like all we need to do is put a pilot in place. We'll demonstrate our value. We'll get sticky. We'll be there. And I agree with that approach. I think that is something that would be highly effective. The reality is, though, on the other side of the table is you still need IS, and not always, but oftentimes your IS team is going to say, well, what's required of us? And oftentimes, if there is a requirement, that's going to raise some red flags. It's going to cause some extra evaluation. There's going to be other teams impacted. So there are steps that I think I was naive on the sales side throughout much of my career where I would get frustrated if a pilot couldn't get across the finish line because it seemed like such a small little bite-sized taste of what we can do. Um, and I still believe though wholeheartedly from the vendor perspective, and now also from a health plan executive perspective, that is a highly valuable way to demonstrate value. So yeah, I'm not trying to say don't continue down that path, but I just want to validate the fact that it is still very difficult to get those across the finish line. And so I found it frustrating before when it wouldn't happen. So it's maybe it's a patience, again, a partnership, a collaboration to ensure that that it can be as easy as possible to demonstrate that business value.
yeah, for sure. And I think that's, I mean, hitting on a really good point. Yeah, I think it's very easy for the vendor to sit there and be like we're putting fees at risk. It's just a small pilot. It's, only a small amount of funding compared to these multi-billion dollar plans. But I think people don't realize like the amount of fixed costs that has to be cleared in terms of return on investment. It's all well and good if you're putting fees at risk, but if it's taking, 10 different individuals, like 6 months of their time to do this, and then there's the time of running it and evaluating it, and then the opportunity cost of what else could they have been doing to achieve that same outcome during that time.
Yeah.
Like there is actually quite a high hurdle just that, like to get to the starting line. And if at any point like there's loss in confidence around, what the return on this is going to be, or even just shifting priorities within the organization during that time, what seems like a real no-brainer idea or like an easy decision is anything but when you kind of actually unpick some of that process and costs that within the organization.
Yeah, Scott, I can make one more point on that, then we can change topics.
Yeah, yeah.
But when you're a vendor, you're very focused on what your solution is and why it's so good and why it will solve that problem. And often, health plan executives, buyers, they're all just humans also. I mean, so there's never any ill intent when these things maybe don't move quickly. But they're just, as you said, so many competing priorities oftentimes that it just sometimes it just can't get across the finish line. And it's never you know, I tried my best, and I learned really well from Brad Garrigus, who was our chief growth officer, recently retired. The way he interacted with vendors was always so positive, to where there was always a respect level, right? That even if it couldn't get across the finish line, like he delivered it with respect, and kept those relationships open because I think it's so important to keep these relationships with these vendors, even if the timing's not right, even if you can't get it across the finish line. Maybe in 2 years it'll work. Maybe a pilot never works, but at the same time, this is a small, very tight-knit community across healthcare from the vendors and the executive side. And I've crossed both sides of the table now. Others will the same way. And I think it's just so important to kind of ensure that even though it's difficult, to keep that relationship alive and do it in a respectful way is kind of the way I'm trying to approach it moving forward as well.
For sure, for sure. And I guess, I mean, that kind of leads into maybe a next question, which is what does a successful health plan vendor relationship look like?
You know, that's a good question. And if I think of framing this a bit, yeah, I can think of two vendors in particular that I personally work with quite a bit and across our teams as well. One that we spend hundreds of thousands of dollars with, one that we don't spend as much with, but kind of on some, both ends of the spectrum, just to demonstrate, I guess, that no matter what services you're providing, it's just still so important to ensure that you're responsive, that you're delivering value, and that and I guess for lack of a better term, just making that executive or that team or that buyer's life easier, right? Helping to achieve and those business outcomes that they're looking to tackle. One of our vendors we work with, I interact with them all the time as part of my national route network responsibilities. And if I have issues, they're extremely responsive. They, from their customer account manager position all the way up to their co-founders, are always ready to go to provide value to myself, to Providence Health Plan, to my teams. And, I find that so valuable that, if I was to send a message that I would know in 30 minutes, I'd get a response and value. The other one is one of our swag providers. And so just to kind of go full spectrum, right? But this particular company is so quick to respond and deliver value and curate creative solutions for us that there's been times we've reached out like, oh my gosh, we need this one thing for this event, or we've got a partnership that we just recently announced with Collective Health, which is really cool. And so we put together some co-branded materials. And on the same end, the responsiveness, delivering value, helping us solve business problems. Both are kind of much different in regard to spend, but as partners have delivered outstanding value. And that's the kind of things we look for in partners, is just knowing that that they're there, right? And that I'll even say from the vendor perspective, I mean, there's been times when oftentimes we would maybe tier customers, right? Like, oh, this particular health plan or system is huge, so we need to make sure we handle them with white gloves, and another one maybe doesn't get the same attention. Those are the ones that'll leave. I know it's difficult to spread out kind of that attention to everyone, but at the same time, having that relationship, because it's a small world, you might circle back with another vendor or another executive when you're in another spot or whatever it might be, and ensuring that you provide that value, help solve business issues, and also just be timely in the responses, I think is huge.
For sure. For sure. I mean, and also in an industry where people do move roles and,
Yeah,
go from plan to plan. I mean, the person who you may be thinking is a bronze tier customer today may be a diamond tier customer there, in a
absolutely.
couple of months' time. And so, yeah, it's very short-sighted to kind of think that anyone deserves a different level of service or a different level of support. I appreciate we're coming very close, up on timing. Probably got time for like one or two questions. Hadley has sent me through a couple, which was, I think you're kind of flipping around. Like, what advice would you give to health plan leaders who are overwhelmed by vendor outreach but don't want to miss innovative solutions? Like, how should they think about screening the inbox after each conference they have, which is no doubt full with 300 different solutions that all sound the same?
Yeah, so at Providence Health Plan, we put together a process that has been pretty successful. Of we put together what we call like a vendor outreach team or a vendor team. Now, of course, can't remember what we actually called it. But where if any of our executive leadership team would get an interesting outreach, it would get filtered to this particular team, which would then meet with that vendor, kind of figure out if it meets one of our strategic priorities, and then kind of help filter it through. We found that to be an effective way to kind of streamline that process. You know, if our chief medical officer is getting a bunch of outreach and she's just too busy to tackle it, this team can help kind of align it to priorities which we have identified each year of what like is important to us as a health plan. Meet with that vendor, and if it makes sense, then we can filter it up to the appropriate teams. And so we've been doing that for about a year and a half or so, and it's proven to be an effective way just to ensure that we're being respectful to these vendors who are reaching out. I mean, we're all humans, right? They're just doing their job, and because of that, oftentimes they'll get ignored though because of our executives just not having the time, and so it gets
For
focused down
sure.
to a team that can help kind of filter it out and ensure that they get some proper attention.
Yeah, no, that makes so much sense. And I guess the kind of the final question, because we've got a minute to go. Um, what's one practical thing that a vendor can do, who maybe trying to kind of, engage with a health plan or get in front of a health plan? Like, what's the most practical piece of advice that you can give to, a vendor on this call who's trying to get in front of a health plan executive?
Just do your research and understand what we're trying to solve for. Um, Again, there's too much generic outreach asking for 15 minutes of time with zero value. Um, if you can understand what our challenges are, I mean, if you look in the news for any health system, any health plan, you're going to see some things that plan or system are working through. Do your research, ask good questions, and don't assume that your solution is going to solve what you believe is the problem. Try to figure out what the problem is, and then try to align and see if there's
Yeah.
the ability to actually solve it. Right. So I think
Yeah.
that just do your research.
Yeah, I think that's so true. I mean, I think one of the best kind of qualification questions or discovery questions that you can ask is like, what is on your to-do list for the rest of this year, or what is on your to-do list this quarter? And like,
Yeah.
find out if that aligns. I mean, maybe it won't align with what your solution is doing, but if it doesn't, you're also saving yourself a lot of time as a vendor, because trying to kind of force something onto someone's to-do list that isn't sitting there organically, it's always going to be a tough ask,
Yeah, and that to-do list could change on a weekly or monthly basis sometimes.
for
And
sure.
so, stay connected, but don't be discouraged if right away it doesn't all check the boxes and work. So, I think outreach and good responses and good follow-ups are important.
Fantastic. Well, look, we're at time, but really appreciate you taking the time with us, Dallas. And yeah, all the best. And I hope we're not going to produce too many hyper-personalized emails landing in your inbox later today.
Well, I love UCF football, so use that as an entry point, and I'll probably respond. Go Knights.
You got to see a lot of subject lines on that topic. But yes, great to see you again, and we'll catch up soon.
All right, thanks, Scott. Have a great day.
See you, Dallas. Bye.